Hello, I'm Richard Stewart. Welcome to Cleveland Health on TV 20. This is the show where we tackle the health issues that matter most to our neighborhoods. Each week, we bring you powerful stories, expert insights, and real resources to help you and your family live healthier, stronger lives. Thank you for tuning in. Now let's dive into what's shaping the health of Cleveland today and try to make a difference together. Today, we're shining a light on several important issues affecting the Cleveland community. In honor of Blood Pressure Education Month, we spoke with health promotion and advocacy specialist Prince Pempton about why it's crucial to monitor your blood pressure and what resources are available to support City of Cleveland employees. We also sat down with Dr. Sam Friedlander, an allergy and immunology expert at University Hospitals. He shares key advice on how to manage symptoms as allergy season kicks in. But first, we take you to FrontLine Services, where we spoke with staff about mental health awareness and the vital support they provide to individuals all across our community. In Cleveland, when someone experiences a mental health crisis, the traditional 911 response may not be the best approach. That's where the Care Response Pilot Program comes in. It's a partnership between the Adams Board and community organizations aiming to deliver care with compassion.
Mental health is a tough one because it's not like when you have a cut or a broken arm, you can't always see it. And the main way you see it is through the behaviors and symptoms people show.
The team supports a 24/7 crisis hotline available through 988 or their local number. The goal? To ensure no one ever feels alone.
And the main goal of a hotline like ours, you can call 988 or call our number directly, is to let people know that there's never a time where they have nobody to talk to. And it doesn't matter if it's 3 a.m. on Christmas, you can call, and we're not here to judge you, we're here to help you.
With growing financial and emotional pressures in modern society, more people are reaching a breaking point.
People are more stressed, they're more desperate, they're more financially strained, and all that's got to go somewhere. Anxiety and depression seem to be at the forefront.
About 42% of Clevelanders reported being diagnosed with depression by a health professional this year. That's up from 26% just 10 years ago. It's a fact that underscores the growing need for increased mental health services here in Cleveland.
There's a big stigma on mental health. People are nervous to ask for help. Some people think that, saying I'm not okay makes them weak. So I think it's important to shine a light on it, just to show people that it's okay to reach out. Spreading the word about 988 and just that we're here to talk. I think a lot of people don't know that the suicide hotline or crisis hotline exists. So making sure that people are aware that it's there and that they can also call in and that they don't have to share all of their information with us, so it can be anonymous. I think that's a big thing for a lot of people.
A unique part of the care response model is its use of peer support specialists. People like Andre Carter, who offer lived experience and understanding.
Help is available for everyone, and that we are here to assist you with getting that help if you really want it. Not having the police involved, it puts the resources that we provide in their proper place. The police, there are a lot of calls that the police just really shouldn't be involved with.
From stigma to support, the Care Response Pilot Program is helping Cleveland rethink crisis care by listening, offering support, and responding with compassion. Coming up next, Dr. Sam Friedlander joins us in the TV 20 studio to share expert advice on allergy relief and what steps you can take to feel better. We'll also hear from allergy patient Kate Bollinger, who opens up about her personal journey and how she manages her symptoms. That and more right after the break.
Today's vote, in my eyes, is not a very difficult one.
Hello, I'm Scott Osicki, Chief Executive Officer of the Alcohol, Drug Addiction, and Mental Health Services Board of Cuyahoga County. We know that life can be overwhelming, but you don't have to face it alone. If you or someone you know is feeling anxious, depressed, in a mental health crisis, have alcohol or other drug use concerns, or just need someone to talk to, help is available. Call or text 988, the Suicide and Crisis Lifeline. It's free, confidential, and available every day 24/7. Trained and caring counselors are there to listen, support, and help you find hope no matter what you're going through. Remember, you're not alone. Call or text 988 anytime because your mental health matters, and so do you.
Hello, I'm Michelle Princeton, and I'm a licensed social worker working for the Social Support Service Unit out of the Mayor's Office of Prevention Intervention Opportunities for Youth and Young Adults. The City of Cleveland has demonstrated a long-term commitment to residents working to create safe spaces in our neighborhood resource and recreation centers where families can access free resources and support services. We are committed to working together with families and other community providers to identify and help families who are struggling to achieve a better quality of life. To access the social support services, leave a message at 216-664-2223 and a team member will return your call. Our work includes referring individuals to appropriate services such as medical, hospital-related, long-term counseling, public assistance, veterans benefits, Social Security, Medicare, Medicaid, food stamps, housing assistance, Head Start, and student loans. We also provide support and guidance for youth and young adults in addressing stigmatization, scapegoating, labeling, bullying, substance abuse, and unhealthy relationships. Once again, to access social support services, leave a message at 216-664-2223 and a team member will return your call. Thank you.
Welcome back to Cleveland Health on TV 20. I'm Richard Stewart, and thank you for staying with us. Today we're focusing on asthma and allergies, and we're joined by two special guests, Dr. Sam Friedlander, an allergist at University Hospitals, and Kate Bollinger, who is a patient. Thank you for joining us today.
Thank you for having us.
What are some of the most common allergens we see in Northeast Ohio around this time of year?
The most common environmental allergens that we see this time of the year are the pollens that are blooming, so trees and grasses. And then later in the year, we're going to see more weeds like ragweed. There's still always a little bit of molds at the beginning of the season, but those tend to dominate more in the fall. And then people that are bothered by allergies are still bothered by their indoor allergies like dust and pets.
How can we differentiate between household allergens and something more serious like a sinus infection or even asthma?
It can be difficult to differentiate between typical allergy symptoms and infectious ones like colds. So a lot of the symptoms overlap. One of the things that is a little bit different in environmental allergies is sneezing. So sneezing tends to be more consistent with allergic symptoms and also eye symptoms. So like itchy eyes, red eyes, watery eyes, that's going to be more likely to be seen in environmental allergies as well. But certainly there's an overlap because both fevers can be seen in mainly environmental fevers can mainly be seen in viral infections, whereas in environmental allergies and in viral infections, you can also have nasal symptoms like congestion and sneezing. So there's a lot of overlap, and it's important to see a physician or your provider to help determine what's causing what.
So Kate, let's go to you. When did your allergy symptoms first take hold, and what'd you do about it?
So I found out I was allergic to tree nuts from a reaction when I was 3 years old, and then I went and got tested. And then that's kind of when I found out I had the seasonal allergies as well. I always had reactions when I was younger to like freshly cut grass and things like that, and so then that's when I started to learn how to get it under control.
So we're in full swing right now in allergy season. I imagine it can be pretty challenging to maintain your health.
Yeah, I make sure to start taking my medicine before I know all the allergens are coming, so just to get ready and prepare my system. Yeah, I gotta make sure I stay on top of my medicines, and I'm still gonna be sneezing and itching nose all the time though.
So Dr. Friedlander, what are some of the common over-the-counter or prescription medications that you would recommend to folks who are suffering?
Last time that I went to the pharmacy, there's so many medications that are over the counter that are available. And it turns out that some of those medicines are very helpful and others are actually dangerous or not helpful. So there are antihistamines that can combat nasal symptoms like sneezing and itchy eyes. There's also nasal sprays that are both antihistamine sprays and things that are corticosteroid based, and those can help with a lot of the nasal symptoms. There's a whole host of eye drops and medicines that also help with the eye symptoms like itchy eyes and red eyes. Some of the medicines, though, it's important to check on the box, will say don't use for more than a few days, because some of these medicines, such as nasal decongestants or eye decongestant drops, can actually make things worse. And I spend a decent part of my day actually trying to get people to combat the side effects of medicines that are over the counter. So I think my best advice would be to discuss these types of questions and medicines with your doctor so that you can find the best medicines for your individual specific treatment plan.
Kate, when it comes to relief, everyone has a little bit of a different story. What do you find helpful in terms of medications or routine to keep you healthy?
Just a over-the-counter medication like Zyrtec, and then I just make sure to keep my eye drops in the fridge so that they're cold and use those whenever I need it, but usually just the Zyrtec will
And that
do the
works
job.
well for you?
Yes.
Good. Dr. Friedlander, are there any lifestyle changes that people might consider to reduce the chances of becoming allergic?
It's important, if you're allergic, to find out what you're allergic to. So depending on what you're allergic to, you might be allergic to just trees, or you might just be allergic to grasses, and that'll help also determine what time of the year might be a problem. But you could be allergic to everything, as some people are, and some things that we recommend are to, when you're indoors, to keep the windows closed so that you're not breathing all those pollens. When you come indoors, to wash up, so to take showers at nighttime to get the pollens off the body and the clothing, and be sure to wear fresh, clean clothes at nighttime. But it's so important to be outside, so I still want people to enjoy the outdoors, and so that's why we look at medications, or sometimes we also will boost the immune system so that people are not reacting to the allergens in the first place.
And are there any new or novel treatments coming online that have you feeling excited about for patients?
Well, I'm still excited about boosting the immune system, and that's something called immunotherapy. So with certain allergies, depending on what you're allergic to, we can actually boost or change the immune system so that the immune system doesn't overreact to the allergens in the first place. So that's to create it so that the immune system goes back to a more normal state, where it basically sees the allergens and just ignores it and doesn't combat it. I'm also excited about some of the new medications that are out. So there's different medicines for both nasal allergies, and also there's some new allergy medications for severe allergies. There's different epinephrine autoinjectors that are really exciting and give people new options of treatment.
Dr. Friedlander, Kate, thank you so much for joining us. That was really valuable information you were able to share.
Thank you for having us.
Good to have you.
Thank you.
And now we turn to the Cleveland Department of Public Health and its ongoing efforts to offer free health screenings and referrals to support the well-being of our community. In Cleveland, the Department of Public Health is taking healthcare directly to the community with its mobile health unit. This initiative aims to bridge the gap in healthcare access by providing essential services to residents where they live and gather.
A lot of people don't trust the healthcare system, so they don't go see their doctor regularly. Some people aren't comfortable going into clinics, and so having the mobile unit out allows them to take advantage of a resource that their tax dollars are paying for and get the care that they need.
The Cleveland Department of Public Health Mobile Health Unit is like a clinic on wheels, providing STI screenings, blood pressure screenings, call it wellness within reach.
We do STI screenings. One is a urine test. We screen for chlamydia, gonorrhea, and trichomonas. And we also have HIV and syphilis testing, which is a finger prick for blood. And then we do blood pressure screenings. Sometimes we use the scale. People don't know how much they weigh. So I've seen a lot of surprised faces behind getting their weight. So it's nice that we can offer different things.
The mobile clinic offers a range of services, including pregnancy testing, prenatal and postnatal information, counseling, as well as general health screenings and referrals. It makes routine stops at Cleveland recreation centers and participates in community events and health fairs throughout the city.
We are being responsive and trusted in the community. A lot of times people tell me things that they probably haven't told their doctor, like they're not taking their medication. And so I just gently guide them to take their medication and take up their concerns with their doctor regarding that. And then also just being available and out in the community and getting to know the community, as well as letting them get to know us.
And we'll be right back on Cleveland Health on TV 20 after the break.
In an instant, everything can change. I know this pain. My name is Nicole Ward. I am the co-founder and executive director of the Make Them Know Your Name Foundation. I lost my husband, Paul, to sudden cardiac arrest. It happens far too often and without warning to anyone at any age at any time. But here's the truth. You have the power to save a life. A few seconds, a few simple steps. That's all it takes to turn tragedy into survival. Be the reason someone gets a second chance at life. Learn CPR. Know how to use an AED. When the moment comes, will you be ready? Step up, take action, and make them know your name. Visit mtkyn.org today.
At Cleveland Rape Crisis Center, we believe that everyone deserves to feel safe, supported, and heard. For over 50 years, we have been here to help survivors of rape, sexual abuse, and human trafficking rebuild their lives and to prevent future violence through education and advocacy. Our services are confidential and always free of charge. We provide 24/7 crisis and support hotline for immediate help, individual and group counseling to promote healing, specialized services for children and families, advocacy and legal support to navigate complex systems, prevention education to empower communities, resources and support for deaf and hard of hearing survivors through our Deaf Pathways program, and drop-in center for the on-spot assistance. No matter what you're going through, you are not alone. Call our 24/7 hotline at 216-619-6192 or text 216-619-6192 or visit clevelandrapecrisis.org to chat with a trained professional. Help is here and healing is possible. Together, we can make a difference.
Welcome back to TV 20's Cleveland Health. Today we're taking time to recognize National Blood Pressure Education Month. And joining me is health promotion and advocacy specialist Prince Pempton from the Cleveland Department of Public Health. Prince, thanks for joining us.
Thanks for having me.
Let's talk basics. Why is it so important this month to recognize blood pressure awareness?
So awareness and education is the first step in prevention. So when you're in that preventative stage, it allows you to catch any type of issue that may occur, such as heart attacks, strokes, or random emergency room visits, which you don't want to happen. And your blood pressure is like your car. When that pressure builds up for a long period of time, what will happen? Your pressure will pop, it'll burst.
So high blood pressure is often referred to as the silent killer. What should folks be aware of in terms of symptoms? What are we looking for here?
So it's the silent killer, or I call it a thief in the night, because it can take your life without warning. And it's a silent killer because there are pretty much no symptoms of high blood pressure. By the time it gets to a high level, it's already too late. And you want to catch things before they escalate. Like I said, it doesn't tap on your window, it doesn't knock on your door, it just comes in, it just wreaks havoc. And some of the warning signs can include, vision problems, severe headaches, irregular heartbeats. And by the time it gets to that point, you're already at hypertensive crisis or high blood pressure.
The Cleveland Department of Public Health offers a variety of resources to help employees focus on wellness. Can you talk about some of those strategies that we use?
Absolutely. So we have our monthly blood pressure checks, which I curate myself, because I want employees to, lower their stress, because you're already in a stressful environment. So you want to make sure that you maintain, that blood pressure and see where your numbers are. Because you want to avoid presenteeism and absenteeism. Presenteeism is when you're at work, but you're underperforming because of your low health. Or absenteeism is when you're missing time from work because of health. And I always want to see people healthy. And we also have our wellness room, which you can take about 15 minutes to, just de-stress, take some moment from those emails, and, come back to homeostasis. And we also have our employee assistance program, or All One Health, where they focus on mental wellness and physical health, and also nutritional guidance too.
Let's say somebody recently found out that their blood pressure was above the normal range. What should they do immediately following that revelation?
First thing, don't panic, because you don't want to add any more stress to what you're already dealing with from the high blood pressure. Talk to your doctor, get a game plan. They may prescribe you certain medication that'll help bring that blood pressure down. Change your activity level, going for a walk, playing with the kids, doing things that'll get your heart rate up gently. Limit your salts, change your diet, because salt has a direct impact on your blood pressure. Those frozen dinners, leave those alone. Quit smoking. Definitely got to quit smoking, because that definitely raises your heart rate or your blood pressure up about 10 points. Find support. That's the EAP, the Employee Assistance Program. Changing your lifestyle, a little more exercise. Because, there are certain things around us that also add additional stress. Work, people, they got to cut you off on the freeway. Those things tend to add more stress onto you, so try to avoid those.
And that was going to bring me to my next question, which is, we all experience stress in one way or the other throughout the course of a work week. How do we reduce that? What would you suggest strategy-wise for an employee to reduce their stress level, keep that blood pressure down?
So try to, take a moment to just deep breath. So deep breathing actually does reduce your blood pressure by about 10 points, because when you're in that stressful state, your autonomic nervous system, or flight or fight response, tends to kick on. So what that is your car or your heart is in neutral, and you're mashing the gas, elevating your blood pressure. So you want to take some time, take a deep breath, go to the break room, and just take a moment to just decompress, take a deep breath.
So we all know education is the first step in prevention. Talk about some of the strategies that you're using to kind of proliferate the message that you're giving here in terms of lowering blood pressure and maintaining overall good health.
Absolutely. So my goal is to maintain good health for our employees and our community. So we do have our monthly blood pressure checks that I do in the break room on the second floor, the first Monday of every month. We have our Quit Strong program, which is our tobacco cessation program to help people, quit smoking and lower their blood pressure. We also do some deep breathing and relaxation exercises in the program. Also health literacy, because you want to know what blood pressure is, what the numbers mean, and how it affects you, and a plan going forward to lower that blood pressure. We also do, we have the wellness room again, take those 15 minutes. We do lunch and learn series about stress management. We have our wellness works about financial health, because when your finances are out of whack, it's causing more additional stress. And we also visit, local schools, libraries, rec centers with our mobile unit that we do blood pressure checks for the community.
Prince, thank you for joining us and sharing this valuable information. It's important stuff.
Thanks for having me.
Now we turn our attention to more May health awareness initiatives, important reminders that can inspire lasting changes for a longer and healthier life. American Stroke Awareness Month. Strokes are a leading cause of long-term disability and death in the United States, according to the Centers for Disease Control and Prevention. Strokes affect nearly 800,000 people per year. Quick action can prevent serious outcomes, but many don't recognize the signs. Learn the Be FAST acronym: balance, eyes, face, arms, speech, and time. Arthritis Awareness Month. The CDC also states that arthritis affects about 53 million adults in the United States. Gentle impact exercise like walking or swimming keeps joints limber and inflammation down. National Physical Fitness and Sports Month. Staying physically active lowers your risk of chronic illness and supports better mental health. When individuals are active, communities grow stronger and more resilient. So get moving, take a walk, hit the gym, or try a fitness class. National Celiac Disease Awareness Month. Celiac disease is an autoimmune disorder where wheat triggers antibodies that attack the small intestine. An estimated 1 in 133 Americans have the disease. Nearly 83% of cases are undiagnosed or misdiagnosed with other conditions. Hepatitis Awareness Month. Hepatitis B and C can go undetected for years and may lead to liver cancer if left untreated. Millions are living with it and don't even know. That's why testing is crucial. If you're at risk, talk to your doctor about getting screened. When it comes to your liver, knowledge truly is life-saving. Well, that concludes this edition of Cleveland Health. Thank you for watching. We hope you learned something that could help you or a loved one live a healthier life. I'm your host, Richard Stewart. Thank you for joining us.